The most frequent ophthalmological disorders and the clinical findings and the treatment. So diseases of the cornea. So the main pathological changes are edema when the eye goes blue-white, fibrosis when the eye is white with a distinct margin, cellular infiltration when the eye is yellowish or white with no distinct margins, vascularization when the eye is fine vessels, and pigmentation when the eye goes brown or black, as seen here, and deposition when the eye has calcium deposits. So cornea ulceration, also known as ulcerative keratitis. You can have the simple or uncomplicated type when there's superficial abbreviation, or you can use fluorescent staining to see if there's an ulcer. And to support the healing, you'd use dethpanethiol, hyaluronic acid, and dexamethasone. And for corticosteroids, use epithelium on the cornea has to be intact, and the conjunctiva stained with fluorescence to rule out ulceration of the cornea. Complicated ulcers, so you can have the melting ulcer, collagenase enzyme activity, digestive stroma because of bacteria or fungi, such as Pseudomonas, Streptococcus, or Aspergillus or Fusarium. The clinical signs are the corneal edema or ulcers, and secondary anterior uveitis. The diagnosis, use the slit lamp, so use a biomicroscope. And fungal keratitis, so a lesion will have fluorescent stain. The fluorescent will circumscribe the ulcer area and the stroma on the surface, so it'll fill up. And desmane membrane, so the fungal elements are prone to create desmetacel, as seen here. And the treatment is antibiotic, tobramycin or gentamicin, or an antimycotic such as natamycin, and collagenase inhibitors such as EDTA. And it's contraindicated, so you don't use glucocorticoids. In surgery, you can have debridement, keratotomy, or rapid corneal melting, as seen here. And the non-ulcerative corneal diseases are the immune-mediated keratitis, IMMK. You can have chronic superficial, it's on the dorsal temporal area of the cornea, or you can have chronic deep stromal keratitis, so the cellular infiltration and edema. And then you can have eosinophil conjunctivitis, so extra tissue in the dorsal temporal area. The treatment is corticosteroids, and the superficial punctate keratitis. So you can have viral keratitis such as equine herpes virus 2, equine herpes virus 5, and this is when you have white spots in the cornea. And the corneal dystrophy in Frisian horses is also another disease. And the corneal stromal abscess, so epithelial cells will cover an encapsulated infectious area in the stroma, and you can have prominent yellowish opacity, as seen here. And then diseases of the uvea, so hyphema, so you have blood in the anterior chamber, and it can be caused by blunt trauma or a bleeding disorder such as thrombocytopenia, and it can be life-threatening in this case. See if it's unilateral or bilateral to see if it is a systemic disease or not. And you can have keratic precipitates, so accumulation of inflammatory cells in the anterior uveitis, or congenital disorders such as iris cysts. They're attached to the granular erratica, or anterior segment dysgenesis, or this is misdevelopment of the iris, or uveitis. You can have anterior uveitis, this is inflammation of the iris and the ciliary body. You can have posterior uveitis, this is inflammation of the choroid and the retina, and panuveitis is inflammation of both. And the cause can be idiopathic, endotoxemia, trauma, or corneal ulcer. When it's acute, you can have conjunctival hyperemia, and when it's chronic, you can have posterior syncytia, iris bomb, cataract, and glaucoma. And in end stage, you can have phthisis bulbi, this when the eye goes completely blind. And the treatment is topical. You can use corticosteroids or prednisolone, or NSAIDs such as megalamine or phenylbutadiene. And equine recurrent uveitis, ERU. You can have active, so it can be phase. It can have active phase and a CAM period. The cause can be trauma, infectious, such as leptospira or streptococcus. It's 80% of the time it's unilateral. Let's see in here. And the treatment is dexamethasone or prednisolone, and or atropine or cyclosporine or NSAIDs. Glaucoma. These are diseases when there's an increase in intraocular pressure. So aqueous humor production. So 30 to 65% of horses have non-conventional outflow. You can have problems with the infiltration, the secretion, and the diffusion. So aqueous humor outflow obstruction can be a cause, or optic nerve, and then it can cause optic nerve degeneration or blindness. And the clinical signs are increased globe size, corneal edema, ciliary body degeneration. And the treatment is laser surgery or intrascleral prothesis.